The theme this year was mental health in an unequal world. Yes, unequal in many respects. Today, we continue the conversation on mental health care with a focus on community care. How can we build a system that supports people with mental health issues at the community level? Well, to do this effectively, let's take a look at the extent of the problem in our communities. And we've taken the pain to do this for you so you can understand how dire the situation is. And you look at data provided by the Ministry of Health in 2021, it reveals that a total of 3.1 million Ghanaians, representing 10% of the country's projected 31 million population, have mental disorders. 10% of the population. According to the ministry, it is established that 41% of Ghanaians have psychological distress, which is either mild, moderate, or severe. And the number of people with severe mental illness on the streets is now 16,000 people out of Ghana's population. That's how many people are on the streets who have mental disorders. Now, you look at cost of mental illness, and it is taking 7% of the country's GDP. Ghana loses 7% of its GDP to mental illness. Even at that, the people who are in charge of taking care of mental people say it's not enough because they need more to do that. Now, let's look at the trend, the incidence of suicides in Ghana from 2018 to 2021. And if you look at 2018, 797 people committed suicide in that year. In 2019, 880 people committed suicide. In 2020, 777 people committed suicide. Luckily for us, in 2021, the figure has dropped significantly from 777 to 417. But that also does not erase the fact that a lot of people in our communities are still living with mental disorders that need attention. If you look at the incidents from January to June 2021, right, so in fact, I can't even call this an achievement because the year has not ended yet, but this figure, 417, is between January and June, which could even make it more by the end of the year 2021. And this reason is why we need to have a conversation about why people are going through all these trauma, stress, and what have you, but nobody is paying attention to them. Let's have a conversation, and I'm joined by Dr. Collins Agyemang. He's a lecturer and researcher at the Department of Psychology at the University of Ghana, and he's president of the National Psychological Association. Doc, I'm grateful for your time.
Sure. For the opportunity.
Now, let's understand what the challenge is when it comes to mental health care. What really is the challenge with this, providing mental health care for people who need it?
Well, Aisha, it looks as if as a country we've made some progress, but the progress is not enough given the needs of Ghanaians now. Some years ago, some decades ago, we didn't have a law that really was interested in the mental health of Ghanaians. And since 2012 onwards, we have a mental health law. And that, to me, is a lot of progress. If you look at the regulation for psychologists alone, we also have a council that is to regulate the activities of all psychologists. For me, that is progress, but a lot of questions are still there. It is one thing having a law, it is another activating what makes the law work. It is one thing having a law, it is another also implementing the tenets, the brain behind, the latent utility of the law. So yes, we may have made some progress in terms of people getting to know that their well-being and mental health is relevant. But I think we have a number of challenges, and if you permit me, I would be very glad to enumerate some of the challenges that is gradually increasing the woes of people as far as mental health is concerned.
Agyemang, tell me what exactly those challenges are.
Let me talk about capacity development. So far, if you look at the data that you shared, we can speak about having almost 50 psychiatrists in Ghana. Now, having a team of psychiatrists is only one side of the discussion. When we talk of mental health, it is a conglomerate of a number of professionals. We need psychologists, even social workers, mental health nurses, psychiatrists. We all need to work together to be able to promote the mental health and well-being of Ghanaians. If as a country we have only 50 psychiatrists, how do we protect the mental health of Ghanaians? At least we have some gains. We have a number of trained psychologists. The role of psychologists is to promote more or less well-being, to optimize the well-being of all employees, all community members, all members within the catchment areas. How many of these psychologists are deployed? So yes, we may have trained a lot of people, but if indeed we do have one district, one factory as an agenda, in my view, having one district, 10 psychologists is even an understatement as the stepping stone to build a fundamental mental health framework. So that is one angle. The other angle has to do with the kind of support that we give to those who are actually advocating for mental health. If you look at the budgetary allocation assigned to mental health, it's very abysmal. It is indeed a non-starter. If you talk about how much support is given to mental health, then you ask yourself, is this of importance to the entire nation? In my view, if we promote the well-being of people, if we promote and optimize the well-being of people, then we will not have serious mental health disorders and mental illnesses within our community. But the point is, the budgetary allocations are so small, then you can competently say that you have challenges managing some of these challenges that we are facing as a country. That notwithstanding, the media, you also have a role to play. I think it's about time we train the media on the best way to be able to actually report. And that is something that indeed we have not been able to do so well. So in terms of training journalists on how they can report on mental health issues, we have a lot of work to do. If we work together, then we'll be able to actually get things done in the right way.
Now, I remember there was a research that you did and said many people in the working environment are actually having one mental disorder or the other. But no one is paying attention to them. How serious is this problem?
So the first question I need to ask, if we say Ministry of Employment, what are some of the things that they do? This is the big question that we need to really look at. Well, if you look at the core mandate of the ministry, one area that I will challenge the ministry to look at is the mental health of employees. Employees are going through a lot of work-related stress. Many employees get bullied, workplace bullying. So emotionally, they continue to labor in their hearts, but they cannot complain. Work-related conflicts are some of the things that are swallowing people. People continue to suppress the challenges that they are facing at the workplaces. Workplace harassment is another that you can speak about. Not to talk about few people who may need mental health support. Are HR managers, HR directors, are they trained to be able to adequately resource their people? Are they trained to identify that this person will be going through mental health challenges and so we need to give support to? There are a number of employees from our practice who make mistakes. They get it wrong. They keep repeating it. It may not be as a result of non-performance, but simply because there may be spillover effects. They are finding it difficult to manage their work with their life or their life with their work. They are finding it difficult to deal with home-related violence. They are finding it difficult to manage life-related challenges that they are confronted with. There could be life-changing challenges that they are not able to adequately cope well. Some begin to use drugs. Thank God it's Friday. They will be drinking, smoking, hanging out with their colleagues at work till 4 a.m. on Saturday. These are all signs that a lot of our employees are going through tumultuous times and they need help. If HR managers and organizations are not taught to prioritize mental health and then they need to optimize, provide support, the same way we provide support for biological health, we need to prioritize the same thing and give support to mental health care.
Dr. Agyemang, what could be wrong with a man who dreams about someone having an affair with his wife, wakes up and decides to take action on that dream?
Well, what I can say is that I cannot conjecture what specifically would be wrong with this man. But on top of my head, given the narrative, one particular psychologist says sometimes our dreams are a reflections of some of the anxieties and the challenges that we may be going through. And that is from the perspective of a theorist who studied dreams. Is it possible this person may be going through a lot of anxious, depressive situations, making the person act out what the dream was saying? My first prescription is that we need to assess this person critically. A clinical psychologist or a psychiatrist can come in to find out, was this person depressed? Is the person psychotic? And once this assessment is done, you'll be able to fully understand what is going on. But what I must say is that it is possible that this person may have one particular mental health situation needing attention. And that is what probably led to he acting out what he saw in his dream.
I guess it's the right time to bring in Dr. Stella Sena Afeti, who is psychiatrist in training at Accra Psychiatric Hospital. Dr. Sena, I'm grateful for your time.
Thank you for having me.
Does this incident have any indication of a mental health issue?
Well, like Dr. Bedu Agyemang said, I'm also not privy to the whole story, but the whole incident seems bizarre. It's a strange happening. It's not something that happens every single day. So one would ask himself or herself, why would somebody just get up one day and then just decide or just say that I had a dream that my fiancé was having an affair with my friend and just decide to kill this person? So we need to explore what actually went wrong. Does he have a mental illness? Has there been something going on? Has there been anything strange going on in his life? What about his behavior? Has anything unusual been happening in his behavior that somebody has noticed? Has he become more suspicious? Is he sleeping less? So all these things, you need to ask yourself these questions. And you can't just make a decision or just reach a conclusion by hearing this story. Of course, an assessment needs to be done. And that's when we would invite this person in to get a full psychiatric evaluation and get to the bottom of this.
Dr. Afeti, I need you to share with me some of the challenges you've had to deal with. For instance, when those days when you see a lot of women at the psychiatric hospital, the common thing that comes to mind is that, okay, some man has given her a broken heart and she has had to go through a lot of stress and then now she's going mad. What are some of the issues that you've had to deal with at your hospital?
Well, Dr. Bedu Agyemang said one of them. The challenge is that we have a lot of people or patients with mental health issues, but very little number of psychiatrists. So you have a lot of people coming to our OPDs, and we are trying to give them our maximum best. But then most of the drugs that we prescribe to our patients are not on health insurance. They're not on the national health insurance. And these patients are on medications that are lifelong medications. They have to be on it throughout their whole life. And with no support, because some of our patients, or most of our patients, are coming from deprived backgrounds economically, so they cannot afford to pay for their health care or purchase their medications. So that brings a lot of trouble. That presents a lot of challenges to us, especially when we are trying to get them to stay on their medications. And another one is that most people, or people that would have mental illness, do not come to the hospital. Why? Because of stigma. Stigma is a very important detriment to our management. So people would have one issue or the other, but they keep it to themselves because they feel like if they should come to the psychiatric hospital, people will see them and point fingers at them. They'll be stigmatized, you know. So all these are challenges that we face. And then we don't have a lot of spaces on our wards. Our wards are full up with patients that have been here for so many years, and we are trying to locate their relatives because patients' relatives would come and leave their relatives, and then they will not come and check up on them again. And then they leave them to the care of the health practitioners, who would have to find ways and means of getting them well. And then when it comes for them to be discharged, to go home, we find it difficult to do that because most of their relatives would have disappeared. So these are some of the challenges that we face at Accra Psychiatric Hospital, where I am now.
Dr. Agyemang, what are the causes of the situation we are currently witnessing?
Well, I cannot agree further with what my sister Senna just said. We need to prioritize mental health care. I think when COVID-19 came, we can see the kind of support that we have given COVID-19. COVID-19 has taken a little over 1,000 people within 2 years. I tell you, the costs of mental health neglect is far more than that of COVID-19. Is it possible we may have to also introduce, let me say, 1% mental health levy? That would be very good to be able to address, especially the resource limitations that we have as far as mental health care is concerned. If you think about road accidents, there is a strong link between road accident and mental health, or mental health and road accidents. In that, if you just check the eyes of people and you give them a license, that is not enough. If someone is anxious, someone is depressed, but have a driving license and is still driving, then in Ghana, we are all in danger. If you look at the youth who are unemployed, they are going through a lot of challenges. If we do not empower them, get psychologists, career developers, career enhancers, those who identify their skill set and support them to realign their thinking and their behavior, then we will be in trouble. Where are the people? Where are they stationed? I can say that we have a number of trained mental health professionals from some angles. We have a number of psychologists from different angles, clinical psychologists, counseling psychologists, industrial and organizational, community, social. Even though psychiatrists may be less, if we blend and pull these people together, assign them to the various hospitals, the various work centers, and what have you, it will be a great starting point. Until we do this, we will continue to keep saying this, and we develop the vulture syndrome. As and when there is one particular case, we will come on air, we will discuss it, newspaper review, we will talk about them, and then by the end of the week, it dies away. Another matter will come up, we will discuss it, it dies away. How long can we continue to be repeating this? Not long ago, we were talking about Abesin. Not long ago, we were talking about Agyemang. Not long ago, we were talking about sodomy. Not long ago, we are talking about this matter. All these issues have mental health-oriented underpinnings. we need to prioritize it. And I feel introducing a 1% levy to support mental health now more than ever is very necessary.
Dr. Afeti, for you, what would be the biggest intervention that can help deal with this challenge from where you sit?
The biggest thing for me is for us to realize as a country that mental health is important. So important that if one is not healthy mentally, one cannot be healthy physically. I think the earlier we start understanding that and living that, then it would be a big step towards making changes. We need to recognize and understand that if mental health is not number one, then we are wasting a whole lot of time just looking at our physical health. I couldn't agree more with Dr. Collins Agyemang about the 1% levy, which would go a long way to helping mental health, our patients. And, just creating an environment where mental health is not, it's not a stigma to have a mental illness. You can say that I have depression. You can say that I have an anxiety disorder and I'm taking medications for it and not be stigmatized for it. So yes, number one is the recognition and acceptance that it is an important aspect of our health system. And number two, just go ahead with what Dr. Agyemang said. A great idea, and I thank him for that. And I also want to add that this week, or the whole of October, is Mental Health Week, or Mental Health Month, sorry. So, and our theme for this year is mental health in an unequal world. And we should take the opportunity that we are presenting, especially across psychiatric hospital. We are offering a free counseling service for anybody who feels that he or she needs to talk to somebody. The numbers will be displayed. I'll share the numbers so that we can display them, to call in and just take the opportunity to share your issue and see how best we can help you. We know that we are living in an unequal world. We don't have equal access to facilities, especially to mental health. And so this is our way of bridging that gap, especially in this month of October, where we are celebrating our mental health month.
Dr. Agyemang, I mean, for people who wake up one day and they do not feel all sound up there, they feel that everything is not all right with them, and they think there is something possibly wrong, what do you advise that they do, or how do you advise they go about this?
The simplest thing I can say to you, they should talk to someone close by them. Just remember how I feel. And that is a good point. That person may not be a professional, but will be able to give you encouragement that it will be well. The next thing that I want to say is that we can feel free to seek help. What that we have. Most of the tertiary institutions have counseling and well-being units. So if we have a number of institutions in all the regions, if we walk to any of the universities, any of the colleges, we will have the opportunity to engage any of the members within the counseling and wellness units. Another thing that we need to say, it is okay to seek help. We shouldn't seek help. Just as Senator mentioned, we are putting numbers, we are encouraging people to talk to us. Feel free, reach out to any of us. If you don't know anybody, feel free, any FM station, radio station that know, call their number. Talk to whoever picked the call that this is how I feel. Can get me someone who can help me. Every radio station, a psychologist or a psychiatrist have spoken there. And that will be another fine starting point to be able to help. At those religious organizations, it is about time to take mental health needs of our congregants, of our students, very importantly in our lives. If we prioritize it and organize programs to support these people that we are grooming, it will be another good and a good starting point to be able to advocate well for mental health support. So all in all, let's reach out. Let's get out there and seek help. If you are able to do so, I am confident that we'll make a good headway. So on our part, individuals, let's reach out. As family members and friends, let's provide social support. As state agents, lawmakers, macro institutions, let's make the resources available to support the people. If we have mental health professionals, let's get them to support all the hospitals, all the agencies, all the workplaces. If we take these bold steps, I am confident we make the best headway, not to come back anytime there is a mental health related issue and discuss them, and it ends there waiting for another month to discuss it.
I'm extremely grateful for your time. Dr. Collins Bedou Agyemang, he is a lecturer at the Psychology Department at the University of Ghana and president of the Psychology Association of Ghana. I'm grateful for your time. And Dr. Feti, you wanted to provide some numbers for people who need help to call?
Yes. Yes.
Please go ahead.
Okay. So as part of our monthly October program in towards supporting mental health, Accra Psychiatry Hospital is organizing a free mental health counseling from 8 a.m. to 5 p.m. each day. And there are some numbers that I'll call out. The numbers are 057 223 2619 or 057 769 0753.
All right.
Or 050 185 9321. So you can call any of these numbers from 8 a.m. to 5 p.m. and you would get your free mental health counseling.
I want to say a big thank you for joining the conversation. Dr. Sena Afeti, she's psychiatrist in training at the Accra Psychiatric Hospital. The number she mentioned, 057 2232 9 or 057 76 90753 or 050 1859321. You may call any of these numbers if you're having challenges and you need help. Let's do more on this one, but that will be after this break. On the polls, Majority Leader Agyemang Sabunso, who says members of Parliament in principle are in support of the promotion of the Proper Human Sexual Rights and Ghanaian Family Values Bill 2021. We'll bring you details shortly after this break.